Hey guys, real quickly, let's go through the rest of these PowerPoint slides. We left off on documentation. Just like anything within nursing, documentation is really important, and it's really important in psychiatric nursing too. If you didn't document it, it didn't get done. It can be handwritten or electronic. Patients can have access to the records just like within, a normal hospital setting. Nurses are responsible for individualized documentation in both electronic and non-electronic health records. So really important that you document and you document correctly. Come on, go. Oops, went too far, sorry. You want to, document. You don't want to document your feelings when you're documenting. We've talked about this before. So observations, what you saw, what the patient said is always good. If you can get like a verbatim what they said, patient states, but never how you feel. Like, I feel like the patient was pretending. That's not something you want to put in there. You want to chart interventions, observations, and any outcomes. You always want to, chart how the patient did during a procedure or during therapy, how responsive they were to those situations. The patient record. So primary documentation. It says in here handwritten documentation, always in pen. So that was from your book, but I don't believe that that's what's happening today. I think it's all electronic. Corrected entries need to be initialed. Again, I think that's old. Meaningful, accurate, objective description. So again, nothing like no feelings in there. It can be used in a court of law. I think you're probably more likely to have that used in a court of law for mental health or a psych ward than elsewhere. Ethics, standards, and nursing frameworks. This is the very exciting part of the lecture. Purpose. So ethical values, obligations, duties, professional ideas. If you've not heard of the ethics, the code of ethics, sorry, it's right at the top. For nurses, you need to look at it. It is on page, I'm looking at it right now, 56, and it talks about the code of ethics for nurses. I'm going to guess you've probably went over this in professional development, but it's really important that you understand the code of ethics. And then box 6.2, which is also on page 56, it talks about best questions for ethical decision making. So if you're ever presented with an ethical dilemma, which I'm going to guess in mental health nursing, you'll probably be faced with a lot of ethical dilemmas and not sure what to do, these are some questions that you can kind of go through to clarify, hopefully, your situation. So make sure you look through those. I actually, during class, I was going to have us go through those together. I had that in my PowerPoint, but obviously we ran out of time. So take a look at those if you can. Ethics for psychiatric nursing. So these were the ones that were listed earlier. We also talked about these in 23-28 or 28-23. I'm going to run through them really quickly because there are questions about this that you'll need to know. You just need to know the difference between these. And if I gave you a situation, could you pick out what crime or what that the nurse committed or what situation the patient was in? So autonomy, that's pretty self-explanatory. Each person has the fundamental right to make voluntary decisions about healthcare. Beneficence, I'm not sure if I said that right. It's also known as goodness. So we have a duty as nurses to act in good ways towards our patients and our community. And we take necessary steps to minimize harm. Justice, that encourages providers to consider how the goods of society are distributed. Non-maleficence, the duty one has to never intentionally harm another. Paternalism, belief that professionals have the knowledge and education needed to make decisions for others and should do so. Fidelity implies that nurses should be faithful to their obligations and duties towards others, society, and nursing profession. And veracity, one's duty to tell the truth. So I believe those are also in your book. They are in chapter 6. So make sure you look at those and understand the differences between them. Oops. The book talks about the standards of practice, 6 components for the standards of practice. So these are basically the nursing process, right? You've seen these before, but a little more in depth as far as psychiatric nursing goes. If you look at page 58, box 6.3, it goes into a little bit more in depth as to what you're doing in each one of these phases. Sorry, I can't get my computer to catch up. Standards of professional performance, these are on page 59, table 6.1. So it talks about education, the quality of practice, communication, do you communicate effectively, leadership, things like that. Again, table 6.1. There are no questions on the standard professional performance. Different levels of practice. We talked about this briefly in class today. Basic is you're a psychiatric mental health registered nurse. You could walk out of school tomorrow and apply for a psychiatric mental health nurse job, and you could have it if you can find one. You usually have a bachelor's or associate's degree or diploma education program. Those are very few and far between now. You use the nursing process to actually treat mental health problems or psychiatric disorders, promote and foster a healthy, safe environment, maximize your patient strengths. The other thing we talked about was an advanced psychiatric mental health nurse, master's degree or doctoral, nationally certified by the ANCC, so you can practice as a nurse practitioner or a clinical nurse specialist. They talk about this a little bit more in box 6.4, which is on page 59. The different things that they do. If you are interested in becoming a nurse practitioner, I'm telling you, this is your ticket. If you have any interest in mental health, they are needed by the dozens, probably more by the hundreds. The next slide just talks about different groups, organizations. You've probably heard of the American Nurses Association. Hopefully you've talked about that in professional development. And then there's also an American Psychiatric Nurses Association. There's associations. There's American, Emergency Association. There's trauma, all kinds of things. OB, I'm sure there's one for them as well. So if you find an area that you're really interested in, I would suggest joining and using those benefits. There's also the International Society of Psychiatric Mental Health Nurses. There's 4 divisions there. They unite and strengthen the presence and voice of psychiatric mental health nurses. So come together. One of the last things I want to talk to you about is the biophysical model, which they talk about on page 60. It's a framework. Sorry, these slides, this mouse. You get the biologic domain, the psychological domain, and the social domain. So each domain influences an individual's mental health and provides a framework for implementing the nursing process. It's a well-recognized holistic model for organizing nursing practice. So you can read more about that on page 60, but this is a model that your book uses, and they should all overlap. Challenges of psychiatric nursing. Well, there are many. I think we probably had several of them brought to our attention today when Emily and Jamie, sorry, I couldn't think of their names, came and talked to us. One of the things that comes up to me that stuck in my mind was what Jamie was talking about when someone's walking behind you and it's the fear of the unknown and you're worried about what might happen. That would be a challenge. Knowledge development, dissemination, and application. So in mental health nursing, obviously, we're still continually finding out so much about it. I think it was just pushed to the side for so long. So many laws were just recently passed that we talked about today to get people proper care. So we're finding out there's so much research coming out. We're finding out so much about mental health. So we as nurses must expand our knowledge base. Overcoming stigma is huge. We talked about this today. There are several questions on the quiz about overcoming stigma. As a nurse, as a patient, you need to know the ins and outs of it and how to dispel mental illness myths. Holistic nursing is becoming really big, including using a mental health promotion and wellness. Holistic means like nursing the person as a whole. We're not just looking at their disease, we're looking at them as a whole. So that really incorporates mental health. And I think you're going to start to see a lot more about holistic nursing in the future. Healthcare delivery system challenges. So we talked a little bit about this today as well. The people are not able to get help for mental health, and there aren't the resources out there. So there's been a push for community-based resources. I think they kind of touched on that today with what that doctor who's leaving the hospital is doing and trying to help some of these nurse practitioners or physicians and kind of be a liaison for them, I guess, or just like a helpline for them to help them prescribe their patients what they need. Impact of technology and electronic health records. So really just standardizing the nursing language so that it's even across the board. There is a table on that on 6.2, page 63, if you want to look at that as well. So those are some of the challenges you might see within psychiatric nursing. Some of the other things we talked about in class, I told you I would get you up to date on. Textbooks should be in today or tomorrow, so please go check. I know you're in class until 4 today, but if you can swing by there this afternoon or maybe tomorrow and look at them, that would be great. I will upload the chapters that I have copied and have those ready for you guys. As far as the quiz goes, it is extremely heavy on, and I will never do this again, but I'll give you a little bit of hint here since we had to stop early. It is extremely heavy on stereotypes. There are questions on mental health in general. There are questions about how are you culturally, how can you be culturally competent for your patient? So if I give you a situation, how would you respond to this patient? Could you pick out the statement that would best reflect cultural competence? There are questions about those torts that kind of talked about, the assault, battery, beneficence, those words. So you need to know the difference between those, which I already talked about. The only thing, like as far as court goes, is there are questions on. There was a slide on whether you're fit or unfit to withstand trial. So I would go back and look at that as well, but very heavy on stereotypes. I would say 5 to 7 questions on stereotypes. There are 2 questions from the movie, but my plan is to open with the movie. And if you watch the movie, you'll get those 2 questions. So we will start with the movie next week. Hopefully you can stay awake at 8 a.m. watching, I think it's like 23 minutes of the movie. Then we'll do our lecture, our activities, and hopefully do movie review number 2 as well next week at the end of class. But like I said, we'll see how things go. What else was I supposed to do for you? Trash cans is being worked on. Brad got a hold of facilities. Badges, they're working on those right now as well. If you guys have any questions at all, I'll be around all day tomorrow. And you can always email me. Good luck at clinical tomorrow. Call me if you have a problem.